Today we're going to show you how to correctly measure for an Össur custom brace. The four tools you're going to need are the SmartMeasure app on your iPhone, a marker for marking your anatomical landmarks, a measuring tape, and your constant force caliper tool. Step one is getting your patient into a natural weight-bearing position. Have them stand with their shoulders back, their feet shoulder width apart, and with their knees slightly bent. Notice the patient looks comfortable in a normal position. Step two is finding the anatomical landmarks on your patient's knee. Start by finding and marking the medial joint space. Next, measure 3/4 of an inch above your medial joint space to find your knee access line. Draw a line across the knee access line. Find your lateral joint space. If you're having a hard time finding the medial or lateral joint space, create a knee access line by finding mid-patella. Next, we're going to find your 3 inches and 6 inches above and below your knee access line. Start by marking 3 inches above and marking 6 inches above, as well as 3 inches below and 6 inches below. Next, we want to find and mark the tibial crest. Start by finding the tibial peak just below your 6-inch mark. Also make a mark at the tibial peak just above your 3-inch mark. Connect the two. Step 3 is taking your circumference measurements at your 3 and 6 inch above and below your knee access line. In centimeters, start at 6 inches above and take your measurement. Then at your 3 inches above, take your measurement. Then at your 3-inch below, take your measurement. And then at your 6 inches below. Next, we'll be taking the ml measurement with the constant force caliper tool. Be as accurate as possible, as this is a very important step in the measuring process. Align the top of the caliper tool with the knee axis line and allow it to sit for approximately 3 seconds. Note the measurement and enter it into your SmartMeasure app. Step 4 is taking your pictures from the anterior and lateral sides. Starting with the anterior, line the horizontal line in the middle with the knee axis line so that the other 2 horizontal lines are aligned with 3 inches above and below. Note that the medial joint space and lateral joint space lines should be visible in the picture. Once the indicator has turned green, take your picture. Next, take your lateral picture. Have your patient turn 90 degrees with their knees slightly bent and line the middle horizontal line with your knee axis line. Once the indicator has turned green, take your picture. Now that you've completed your anterior and lateral photos, complete the other sections in the app and place your order.